Your oral hygiene habits are an absolute fail and probably shaving years off your life, and you don't even realize it. My name's Dr. Dave Chotner, and I've been practicing dentistry for more than 20 years. One thing is very common with my patients. They all struggle with their oral hygiene habits. When I ask patients, how often do you floss? Their answer is always the same. Not as often as I should. And even the patients who think they have perfect oral hygiene habits are usually struggling. They just don't realize it. The bacteria in plaque is like a silent killer. It invades your bloodstream. Over time, it causes systemic diseases like cardiovascular disease, dementia, Alzheimer's, stroke, diabetes. It's terrible. My job as a dentist is to help people evolve in their oral hygiene habits. But the problem is the current tools that we have, which are essentially toothbrushes, dental floss, certain rinses that you might buy at a store, they're not enough. The toothbrushes, especially the electric toothbrushes, are too hard, they're too invasive, and people's flossing habits are frankly an absolute joke. Then add in rinses. These rinses are extremely aggressive. They destroy the oral microbiome. They have alcohol in them, and they're basically something that you should never use. At the end of the day, you need something easy and simple. And that's why I created RevitaBIte. Now, if you're watching this video, you might already know about RevitaBIte, which is an amazing functional chewing gum that combats periodontal disease, supports your oral microbiome, and helps to harden your teeth. And it also tastes amazing. But in today's show, I want to talk to you about a study I did recently. 3 patients came into the office. I had them not brush their teeth for a little bit more than 24 hours. So they went to bed. They brushed their teeth in the morning. They went through their day. They went to bed. They did not brush their teeth before bed. And then they woke up in the morning and then also did not brush their teeth. So they had eaten breakfast, lunch, dinner, and breakfast, and multiple snacks and probably some coffees for more than 24 hours. And we did this little study. And this is what we did. So we used this product made by Sunstar called, it's a disclosing tablet. It looks like this. And basically what you do is you chew these little tablets for about 30 seconds. And what it does is there's a dye in the tablet that stains the bacteria and the plaque. And so what it helps you do is identify that plaque, because the plaque's clear and transparent, and ultimately you don't know that it's there, which is frankly the reason why most people's oral hygiene habits are not good. So let's just go ahead and jump into the first person here. So this is the first patient. You're looking at this picture and you're saying to yourself, oh, this person's teeth look perfectly fine. There's no problem here. But again, this is more than 24 hours after not brushing, multiple meals, and with the disclosing tablet in the mouth, chewed for 30 seconds. This is what it looks like. Now, it's disgusting. I realize that. But what I want you to notice is the area around the gum lines. Look at how red, almost like blood, right at the gum lines. And that's just a dye. Now, the bacteria at the gum line is the part of the mouth that's most dangerous. So if you leave plaque at the gum line to this degree, it is a simple gateway into the blood vessels. So the systemic diseases and the reason that I call plaque a silent killer and the bacteria so deadly is the likelihood is that you're not cleaning this area sufficiently enough with your toothbrush and your flossing habits. Well, you're not, because I've been telling you for 25 years, this is how all my patients look. So at the end of the day, we need something more simple. Now, the RevitaBIte product is quite effective at cleaning your teeth without brushing and flossing. Now, I'm not saying you should never brush and floss your teeth, but what I want to show you here, let's go back to the post-operative here. This is after chewing the gum for 20 minutes. Look at the transformation between this image here and this image here. Is there still some plaque in there? Yeah, there is. 20 minutes. I would suspect chewing it for 20 more minutes and the flavor lasts that long, it would be even cleaner. But look at the before and after. I mean, listen, you're not going to brush your teeth properly every day. You're not going to brush and floss your teeth the way you're supposed to. You're not bringing a toothbrush to work with you and brushing after meals. When was the last time you did that? Answer, never, because nobody does that. Maybe a very small percentage of the population does that. But at the end of the day, you need something that's going to help you. Otherwise, you're allowing this silent killer to get into the bloodstream and spread throughout your entire body. Let's look at another case. Same story with this one. This one's not as severe, but I want to go through it real quickly just so you can see. So this person has less plaque in their mouth just in general. And so if you can see here, here's 30 seconds of chewing the disclosing tablet. And then, of course, you can see there's a couple areas where this person's building up quite a bit of plaque. Some definitely between the contacts of the teeth. And then over in the gum line over here in the back, you can see it a little bit more obvious. It doesn't matter if you have a little bit of periodontal disease or a lot of periodontal disease. Any amount of periodontal disease is going to lead to potential for systemic diseases. So let's go ahead and look at the post-op for that one. So here's what she looks like after chewing RevitaBIte for 20 minutes. It looks like, look at this, right in this area here, look at the transformation. You can actually see a marked decrease in plaque right in this little area here that I'm circling. Look at this. And that plaque didn't even pick up the stain that much. It really, and honestly, it's like she had teeth whitening. These photographs were taken in the same location in my practice, 30 minutes apart. The lighting didn't change at all. The RevitaBIte gum not only cleaned the teeth, but seemingly did some teeth whitening as well and removed the stains. Let's look at one more case here. Here is another patient. Same thing. 24 hours, multiple meals, coffee, snacks. I don't know. Who knows what she ate. I'm sure she ate a lot of stuff, but the plaque was still growing in the mouth because here is what it looks like after 30 seconds of chewing the disclosing tablet. I gotta say, this is the post-op. I've got to say, the transformative situation from 20 minutes of chewing this little piece of gum. I mean, look at this. This is all that it is. You just put this in your mouth and you chew it. When you can't brush, you chew it. Let's go back to this previous image one more time. I mean, this is a metamorphosis. This product is a game changer in the oral hygiene market. Again, I'm not saying you shouldn't brush and floss your teeth, but RevitaBIte is a game changer to support your oral hygiene habits. And like I led in with in this short little episode, the bacteria in the plaque at the gum lines is a deadly killer. It's a deadly killer. It's causing systemic disease right now, and you don't even know it. All you have to do is chew a simple piece of gum, and your oral hygiene habits are completely solved with a tasty piece of gum. Go get some RevitaBIte today.